Right now, infectious disease experts are working in communities, at local hospitals, at research institutions, and in public health departments to protect and treat people who have COVID-19. Many still are hesitant about the vaccine, though. Answering the most common COVID-19 vaccine questions is Dr. Douglas Drevets of University of Oklahoma Health Sciences, specializing in infectious diseases. Hi, Dr. Douglas. How are you?
I'm doing great. Thank you for having me.
Thank you for joining us. So, do existing COVID-19 vaccines protect against variants?
That is correct. You know, they actually do quite a good job. Obviously they're not perfect, but we still have quite a bit of protection from the vaccine against this new variant, the Delta variant.
And what does the data tell us about COVID-19 in the community?
Well, you know, like many places, about 98% of the COVID-19 cases right now in the central U.S. are caused by the Delta variant. We also know that well over 90% of individuals who end up in the hospital now with COVID-19 are unvaccinated. And so even if you do get sick after having a vaccine, this is what's called a breakthrough infection. You have a much, much lower chance of being hospitalized or having a bad outcome, meaning a fatal outcome. So they really do help you out a lot.
And what is most important to know about COVID-19 variants, and why are we seeing them now?
Well, I think the important thing is to know that the virus is mutating constantly. It's the type of a virus that is designed to mutate. And so we will see new strains come out probably every year, maybe even several times a year, that are in some way, shape, or form better able to infect others, to spread. And so then they take over in a sense, and that becomes what we call the dominant variant. The thing to know is that right now, the vaccines available still provide a high degree of protection. And so it's really urgent that folks who are not yet vaccinated go ahead and take that step and get vaccinated.
And another common question people ask are, what are the symptoms of the Delta variant? Are they different from other strains?
They are not materially different. We're seeing a little bit more headache in folks with the Delta variant and maybe more runny nose than we were with some of the earlier strains. But by and large, it's the same old thing. You feel terrible, you have a cough, very fatigued, fever, and the like. So not a whole lot of difference that you can tell.
Thank you so much, Dr. Drevets, for joining us on The Shortcut. For more information, you can also check out the Infectious Diseases Society of America website at idsociety.org.